Mm. ஆனா அந்த டைமுக்கு ஞாபகப்படுத்தணுமா இல்லையா?
நான் இந்த இடத்துக்கு போட இந்த லாஸ்ட் வந்தேன். நம்ம ஈஸியா ஓபன்
Good afternoon to one and all present here. We welcome our Dean Sir, Vice Principal Madam, members of organizing
Johnny as
Dr. Pooja, your audio is muted.
Hello, sir, am I audible?
Yeah, now it's fine. Now it's fine.
Yes, sir. Good afternoon to one and all present here. We welcome our Dean, sir, Vice Principal, Madam, all the members of Organizing Committee of FDP, panelists for today's session for the National Faculty Development Program on Student Wellbeing, Salutogenesis, organized by Student Salutogenesis Committee, Department of Psychiatry, Mahatma Gandhi Medical College and Research Institute, Pondicherry, in collaboration with Department of Psychiatry, AIMS Kalyani. Today's session will start with a talk on mental health screening program conducted in SBV. This talk will be given by Dr. Vimalnathan P, Assistant Professor, Department of Psychiatry, MGMCRI, who is also the organizing secretary of this FDP. May I please request sir to come and give this session.
Good afternoon, everyone. Today I'll be talking about, before going to the panel discussion, I'll be talking about the screening process, what we are doing in our SBV University. So about the Student Salutogenesis Committee. So about the overview, like it was started in 2014 as a supervised self-assessment of psychological well-being screening, which was started in 2014 as a part of general health screening in our institute. It was done for all the MBBS, MD, BDS nursing students at the time of joining for the benefits of, they'll benefit from this process. This committee was officially formed and renamed as Student Salutogenesis Committee in January 2022. So the members consist of Dean Sir, Vice Principal Student Affairs Ma'am, HOD of Psychiatry, Assistant Professor of Psychiatry, and one clinical psychologist, and 2 student counselors. So here, what we do is, so we generally do a awareness program on the relevance of mental health and well-being for the medical students. So which we usually done on the orientation program. So this was, we usually orient the family, the parents of the students also about the mental health screening. So followed by, we provide a awareness program to the students. This was followed by familiarizing the students with a specially designed pro forma, that is mental health and well-being questionnaire for gathering information. So each of the items in the mental health and well-being questionnaire, which is a self-administered tool, were explained to enhance the understandability and increase the probability of true responses. So generally, we used to orient the students about the mental health and well-being questionnaire. So there we used to provide a PowerPoint presentation also for the above exercise. So subsequently, a brief interactive session was conducted with the students where they were informed about the purpose of the exercise and assured about the confidentiality of the information shared. So it was expected that this would make students feel at ease and facilitate their active participation. So this entire session lasts for almost 1 to 1.5 hours approximately each time. So the self-assessments were conducted on, before we used to do it on the Kobo Collect app. So where the we provide the students a tab where the questionnaire is already loaded and students gave the response to the questionnaire on the tabs. So at most it took 1 hour for each batch. Now we are doing through the Google Forms. So this is a mental health and well-being questionnaire which we are doing here. So it contains the details of identification like the name, UID number, sex, age, etc. So they used to, scales to assess the levels of resilience students possessing using the child and youth resilience measure or the Resilience Research Center adult resilience measure. So either depends on the age. If it is less than 18, we used to provide children scale. If it is adults, we used to provide adult scale. So selected aspects of self. So this resilience scale contains almost 27 questions. And the second one is the selected aspects of self-representation of subjective well-being and distress using the general well-being questionnaire, which contains almost 25 questions. So in addition, the pro forma include information regarding the past and present personal history of psychiatric illness and treatment. Also, it has a family history along with the provision for direct help seeking for any mental health issues or psychological discomfort. Like, do you require any help regarding the your health, mental health? So there will be a direct questioning. So where the students will say yes or no, whether they need help seekers or not. So following this, we'll have a student's feedback also about the questionnaire, what they felt about this mental health well-being questionnaire. So both the above mentioned, both the resilience as well as the general well-being scales were they're all the published scales. They were selected after thorough review and consideration with regard to the purpose of survey, understandability of scale items, ease of response generation, clarity of interpretation of scores, cost, and accessibility, and total duration of evaluation process. So here, after giving the students responded. So after then the psychologist will analyze this the process. Here I will classify the students into one person comes under the normal group, and here we classify into two groups, like students in need of additional psychological support, what we call it as SNAPs. So here the level 1 student and level 2 students. So level 1 students, like they need to be monitored, whereas the level 2 students need to contact them mental health care team. So I'll describe about the group description also. So the level 1 students were those who are like general well-being score of range of between 61 to 72, where they comes under moderate distress, and their level of resilience will be better. That is between the 25th to 75th percentile. And when they say ask about help seekers, when they ask for the help, so this three categories will comes under level 1. Whereas level 2 students, they have they have any past history of illness, who are currently on any psychiatric treatment. If their general well-being score is less than 60, they comes under severe distress. And when their level of resilience is less than 25th percentile. So also like help seekers with any of the above 2 level criteria. So this these students will comes under level 2. So this is a algorithm what we follow here. Like we classify into level 1 and level 2. The level 1 students, they will contact the student counselors. Again, the student counselors will re-administer the general well-being health score. Again, the scores, suppose if they comes under the below the cutoff score, then the student counselors will monitor and provide regular support. Whereas if it is again the scores comes above, again the student counselors will assess. They look for any mood or anxiety symptoms. If it is not there, then they always provide the regular intervals. They will provide support system. Whereas if it is the level 2 or whenever they have any mood or anxiety symptoms, so they'll be referred to the psychiatric department, where the psychiatric department will take care of the mental health issues. So till then, the student counselors will be the case manager for overall the process. Here, the intervention management will be what we do here is the level 1 students may gain from re-evaluation to rule out any current depressive or anxiety symptoms. So sessions with the student counselors at regular intervals and mentorship under senior departmental faculty members as per requirement or discretion of our student counselors. So also there will be a close monitoring of their emotional adjustment, their clinical work and academic progress. Also, like they will have a periodic psychological assessment. And the level 2 students will benefit from formal and structured psychotherapy sessions, whether with or without medication. If suppose if they require medications, obviously, like after informing the parents, like we used to start mentorship under senior departmental faculty members as per requirement or discretion of student counselors. Also, there will be a close monitoring of emotional adjustment and clinical work and academic performance. And there will be they will provide short-term support and guidance for help seekers provided by the student counselors. So this analysis part and reporting part will be like the clinical psychologist will be doing, followed by the confidential report will be reported to Dean sir as well as Vice Principal Madam from HOD of Psychiatry. So the limitations in this process is like this depends entirely on the honesty of the students. So that's why we always do the orientation process before giving the questionnaire. And the second one is the follow-up. Following up the students is highly difficult actually, since we lacks a lot of the technical methods. So now only we are trying to implement certain EMR methods like electronic method records, like we are using Trello, but before we lack such methods. That's why we have a difficulty in following the students. And also this process will fail to pick up the problems. That's why sometimes the students comes on their own bypassing this algorithm. Also, and another thing is the analysis and reporting is a tedious process and also a time consuming. So the manpower is needed always here. And now we are applying for the copyright process, copyright for this student license committee. And this is a process what we are doing in our institute. So these are all the references for the scales. So thank you. So any queries, so you can ask or you can post in the WhatsApp group. Sorry, in the chat box. So the participants can post your queries or you can start asking your queries. Following this discussions, we will start our panel discussions.
Sir, good afternoon, sir.
Yes, ma'am.
Sir, this awareness program, what you're doing, that you're
Yes,
doing
ma'am.
for the entire batch, sir, or you're dividing it into smaller groups?
No, ma'am. We are doing for the whole batch.
7, 8.
So before that, during the orientation
Okay,
process, which has both the parents as well as students will be there at the time of the ceremony. By the time the admin itself will inform about the support system, whatever we are providing. So where they will be the parents also informed about the mental health screening. After this only, after a period of probably after joining, probably after a period of 1 month, we started doing the screening process. So we used to have awareness program about the mental health, and then only we are also orient them about the mental health well-being questionnaire. Then only we give the questionnaires to the students under the supervision of some faculties or PGs will be there.
So parents are there both for awareness as well as the description of the questionnaire, sir? Parents
No,
are there for both the sessions?
No, ma'am. Parents won't be there during the awareness program, ma'am.
They are not there. Okay.
So we are planning to, in future, we are planning to implement for the parents as well at the time of the ceremony programs.
Okay.
And more, and they will be informed about the process actually. If the students comes into level 1 or level 2, the parents also will be informed from the admin.
Okay. So in this case, you take consent from whom, sir? You're taking from the students or from the parents?
From the
To do
students.
the
From the
from the
students.
students only. Okay.
So any other queries, ma'am? Sir? So this is this is algorithm or the process what we are doing. So the participants can ask your queries.
This general well-being health score has how many parameters, sir? How many questions? Like
General health well-being scale has 25 questions, ma'am. Whereas resilience has 27 questions.
okay, so how long does it take, sir, for the students to fill it? Like half an hour?
So mostly depends on the students, ma'am. So the overall process, the whole questionnaires, it will take at maximum 30 to 45 minutes only, ma'am.
30 to
So
45 minutes.
it will be it will comes under the Google Forms. So Google Forms before we produced in a Kobo Collect app. So the overall questions will be there. We put up in that particular app. Starting from the UID number till the feedback. So it will take almost depends on the students from 45 minutes to 1 hour. So where the faculty or the PG also will be there to assist. If they have any doubts in any of the questions, so they'll also be there to support them.
Okay, and so consent is, if at all they are filling up the Google form, it is taken as consent, sir, or you have made a separate consent form?
It's same, ma'am. Yes, ma'am. Google Forms.
Google form, okay.
So any other queries, ma'am? Okay, so like. Okay, this session is followed by like, so the student counselors part, what they are doing after the process. So like about the student counselors role, like Ms. Priya Philip will talk about the role about the student counselors.
It's on the desktop. Choose this one. Thank you.
Yes, good afternoon, everyone. So I'll be covering the role that the student counselor plays in the salutogenesis committee and the role of the student welfare department here. So generally, when students come into college, we find that there are a lot of reasons for why they actually have a lot of stress and anxiety. So we feel that they're just moving from school to college. But actually choosing a major in college is also a very big choice for them. So that causes a lot of stress for them. They are moving from a different place. It could be just from school to college, or it could be from city to city. So transitioning from school to college covers a lot of things, and it may be the first time that they are living away from home. And at this point, the college needs to be a home away from home for them. So this could also cause a lot of stress for them. Maintaining a healthy diet and healthy lifestyle. Once they're away from home, given the lifestyle that we have in the present generation, there's a lot of fast food here. So maintaining a healthy diet for them is also a problem which can cause a lot of stress. And also moving away from home, they need to make new friends because they're moving from school to college. It's an absolutely new environment, a new place and new people. And if it's a different state, then they have to get adjusted to the new culture also. So these are the some of the reasons which the students face, the problems that students face when they come to college. So the channels used here in our university to cater to the students are the psychiatry department, as Dr. Vimal has just mentioned, the management of the respective college units, voluntary help seekers, and the general sessions that we have. So the psychiatry department role was just explained by Dr. Vimal. So after the screening and after they are sent to us, we give them the individual sessions. And as you already explained, we do re-administer the general well-being scale. And if necessary, we do actually refer them to the psychiatry department. If not, we manage them ourselves by giving them individual sessions and supporting them in ways that they need. And if the students are being accompanied to the psychiatry department, the student counselor will accompany them to make sure that they are comfortable. The parents of the student are informed with the consent of the student and the discretion of the management regarding the sessions. And they are requested to visit, the parents are requested to visit the student counselor to discuss the student's condition if necessary. So the next mode of the next level through which students come to the student counselor are through the management level. So it could be through the dean or it could be through the vice principal of the respective college. So they come here for the following reasons that you see on the screen. So mostly it is low attendance and they're not able to concentrate in class. They have low performance. They have issues with other students or they're homesick. And mostly for first year students, it's adjusting to the new environment and the new curriculum that they're facing because it is so much different than what they are seeing and what they faced in school. And once they come to us, again, we provide the necessary guidance and support. So we give them the space to feel free and talk to us so that, they are open enough to express what they need. And it generally takes maybe like 2 or 3 sessions for them to open up. Being a new place, we need to provide this time and space for them. And generally, maybe after a couple of sessions, they do tend to settle down and they do tend to express themselves. In some cases where they express depression or anxiety symptoms, then we do tend to refer them to psychiatry, or mostly we tend to give them general sessions of more self-esteem, how to increase the self-confidence, or how to maybe adapt to new places, how they could make new friends. So again, this making of friends and settling in a new place is what I find most of the students face. Because being away from their parents, they need someone to talk to, they need someone to share their day with. The next group of people are voluntary help seekers. So these are students who come to the student counselor on their own. Generally, how this happens is we have sessions for the college students year-wise. So like once in 3 months, we have a general session for them. So this is to create awareness that the student welfare department is there and that we are open to help you. So when they regularly see us, they actually get more accustomed to us, and I find it that they are more comfortable in approaching us and talking to us. So through these sessions, after these sessions, they do come to see us, and they express that maybe they're feeling lonely, or they're not studying well. They want to perform better. And also another thing that I've seen with voluntary help seekers is that they also actually suggest to their friends to come and meet the student counselor. So I feel that the general sessions have helped a lot for the individual, as well as the individual suggesting their friends also to come and visit the student counselor. And for the voluntary help seekers, the general sessions that we do take for them is mostly these are individually customized sessions. Sometimes they can be in groups, but 90% of the time they are individually tailored to the student. So the topics that we discuss are self-esteem, goal setting, memory techniques, vision board, and affirmations. So these will actually help them, be more confident about themselves. Goal setting will help them get a clearer view on where they want to go and why they're going. So mostly after they settle into college, after a few months, they tend to become a little bit too comfortable here, and they sometimes lose focus of what they're doing and how hard they actually need to study in a medical setting. So goal setting actually puts them back on track. It actually helps them visualize at least 5 to 10 years ahead, which gives them a clear path for them to follow. And memory techniques, it helps them to sharpen their brain. So we teach them a couple of techniques that they can practice every day, which takes maybe like 2 or 3 minutes. So this actually helps them to be more alert and concentrate better. And also among these students, if necessary, if we feel that they have any behavioral issues, or they're not sleeping well, or they're not eating well, then we tend to refer them to the psychiatry department. So this is the general sessions that I was already talking about. So we conduct these sessions for the students to bring awareness about the importance of mental health, and also it's kind of like a motivation session for all of them. And we do this every quarterly for all the batches. The sessions covered here, one is the foundation course, which is done for all the first years who enter into the college. We find that this helps them to settle down in the new environment. It helps them to adjust to the new batchmates that they are with. It helps them to adjust to the new college, the hospital block. So they are like taken around and into the different blocks, and an introductory session is given in the departments. So, and as a part of the student welfare department, we actually have sessions with them for their educational environment. So how their how their environment helps them to study better. And also there's a session on the vision board where we actually have them create a vision board then and there. So it's like a 2-hour session. So this also helps them to focus their goals, and they are allowed to actually take this home to their rooms and stick it up so that every day when they look at it, they are motivated to perform better. And some of the topics that we cover in the interactive motivational sessions are importance of the study environment, de-stressing and techniques to relax during the academic year and during the exams, memory sharpening techniques, and the importance of planning. So these are the 4 ways that students approach us, and how we cater to the needs of the student. And in our university, we give a lot of importance to the mental health of our students, and all the departments put together are collaborating to do a good job, and we try to do our best to keep them mentally healthy and happy. Yes, thank you.
Thank you, ma'am.
Sir, is there time for questions?
Yes, ma'am.
Sir, so the student welfare committee, who are the members, or how many people are there? How many faculty are there?
So we have, as I mentioned before, no, ma'am, we have the committee contains the dean, the vice principal, students affairs, HOD of psychiatry, and one assistant professor from the department of psychiatry, and one clinical psychologist, and 2 student counselors.
So the student counselors are psychologists?
I mean, they have done their psychology, ma'am.
Psychologists. Other department faculty are not involved, sir, or? I mean,
No, ma'am. I mean, it includes from the admin level and department of psychiatry.
okay. So the onus is more on the department of psychiatry then.
Yes, ma'am. So thank you, everyone. We'll start the next session.
Thank you, ma'am. Now we'll be moving on for the session. So the moderator for today's session is Miss Priya Phillips. She is Student Welfare Officer, SBV. Ma'am has done her MSc Psychology and MA Sociology from Stella Maris, Chennai, MHRM Pondicherry University, and MSc Yoga Therapy from MGMCRI. Presently a research scholar of yoga therapy. she's working as the student counselor for MGMCRA for the past 7 years. Ma'am has also represented India twice in the International Youth Conference at Malaysia. She has been invited as a resource person and a guest speaker in many esteemed institutes. Ma'am has held the position of secretary and treasurer in Astronautical Society of India, student chapter as a unit of ISRO. She has held the post of president, secretary and treasurer in the Lions Club and been an active member for 14 years. Ma'am has held the post of Leo advisor in the Lions Club, which caters to guiding college students in organizing workshop and events for them. Ma'am will be introducing the topic and also introducing the panelists for today's session. Over to you, ma'am.
Yes, thank you. So good afternoon, everyone. I welcome you all once again to today's panel discussion on the topic collaborative strategies for student salutogenesis and preservation promotion of health and well-being. We have with us an amazing set of panelists representing the departments involved in the salutogenesis of the students here in our university. Today, we will be discussing the challenges faced and the strategies implemented here dealing with the students. We will also go on to brainstorming on the possible strategies that could be implemented going forward to support the salutogenesis program. The panelists that will be joining us today here are our esteemed Dean Sir, Dr. Sitish Ghosh, our Vice Principal Madam, Dr. Batmavati, Dr. Shobana, Dr. Balaji, and Mrs. Josephine. And HOD Sir of Psychiatry, Dr. Siva Prakash Sir. I now hand it over to ma'am to introduce the panelists.
May we please request the panelists to take their seat over the dais. Dr. Sitish Ghosh Sir is Dean, Professor of Obstetric and Gynecology, MGMCRI. Sir has done MBBS and MD from SCB Medical College, Odisha. Sir has done has an experience of PG UG for 25 years and has been guide and co-guide for postgraduates about 18 and PhD 4 students. Sir has also done fellowship in Indian College of Obstetric and Gynecology and International Medical Science Academy. So in total, sir has 88 publications, both national and international, indexed in peer-reviewed journal. Sir is also reviewer in national and international journals. Sir has had done training in advanced course in minimal invasive surgery, certificate course in hospital management, and advanced course in medical education. We welcome you, sir. We would now request Dr. Padmavati ma'am to come to the stage. Dais. Ma'am is Vice Principal Student Affair, Professor of Pharmacology with post PG teaching experience of 12 years. Currently, she holds the position of Vice Principal and an undergraduate alumnus from Kilpauk Medical College. She has done her post-graduation in pharmacology in MGMCRI. She is coordinator of Mentor-Mentee Committee of the Institute. Ma'am is also a member of Student Salutogenesis Committee. Ma'am has completed an online course on exploring the student affairs in higher education profession conducted by Colorado State University. We welcome you, ma'am. Now we would like to welcome Dr. Shiva Prakash B, Professor and Head of the Department of Psychiatry, MGMCRI, Pondicherry. Sir has completed his MBBS and MD at JIPMER. After serving as SR in Psychiatry in JIPMER for 3 years, he has joined as Assistant Professor in Department of Psychiatry, MGMCRI in 2002. He has 26 years of experience in academic and clinical psychiatry. Sir is also an adjunct faculty at the School of Music Therapy, SBV. Sir is also a member of Student Salutogenesis Committee, MGMCRI. Sir, special professional interest is psychosomatic medicine, medical education, communication skills, mental health, literacy, and many more. Sir has conducted modules on literature search, reviews, and reference management at dissertation and thesis workshop. Sir has public scientific journal publication of 35 and has also contributed in 9 book chapters. Sir has played a major role in development of protocol for supervised self-assessment of psychological well-being for students of SBV. And sir has also played a vital role in development of communication skill training modules for SBV students. We welcome you, sir. Next, we would like to welcome Dr. R. Shobana, Professor of Physiology, MGMCRI. Ma'am has completed MBBS from Tanjavur Medical College, MD Physiology from MGMCRI, PG Diploma in Music Therapy and PhD Physiology from SBV, NHET Simulation from Monash University, Australia, Fellowship in Medical Simulation from International Pediatric Simulation Society. Ma'am is the Deputy Director for Medical Simulation Center, Clinical Skills Curriculum Task Force member of MGMCRI. She is an adjunct faculty, Center of Music Therapy Research and Education, SBV, actively involved in community and outreach activities as a guest speaker, panelist, resource person, organizer, and volunteer. Ma'am has also attended several CMEs and workshops at state and national levels as speaker and presented paper in various national and international conferences. She has a publication of both national and international journal 27. We welcome you, ma'am. Next, we would like to welcome Yoga Chammal Dr. R. Balaji, Assistant Professor, School of Yoga Therapy, ICSM, SBV. Sir has done MBBS from MGMCRI, Masters in Emergency Medicine in Apollo Hospital, Chennai, Fellowship in Diabetology in IMA Tamil Nadu branch, and MD Alternative Medicine from Institute of Alternative Medicine, Kolkata, and MPhil in Yoga Therapy, and CY TR of SBV. Now it's upgraded as a School of Yoga Therapy. Sir has past experience as Assistant Professor in Center of Yoga Sciences, AVMC Pondicherry, and Chief Medical. Sir has also served as Chief Medical Officer at AVMC and Senior Medical Officer at MVR Multi-Speciality Hospital. Currently, sir is pursuing his PhD in School of Yoga Therapy, ISM of SBV, and working as an Assistant Professor in School of Yoga Therapy. Sir has medical consultant in Mother Care Foundation, a center for addiction and rehabilitation, and yoga therapist and teacher, Yoganjali Natyalam, and International Center for Yoga Therapy and Research. Sir has received various yoga-related national and international awards and championship. He has also published papers across various national and international reputed scientific journals. We welcome you, sir. Next, we have Miss Leon MB Josephine. Ma'am is a senior student welfare officer, SBV. She has completed her MSc Applied Psychology from Annamalai University and MSc Yoga Therapy from Tamil Nadu Physical Education and Sport University. She has an experience of 6 years as senior student welfare officer of the Student Welfare Department, SVV, covering medical, dental, nursing, and College of Allied Health Sciences. She has more than 2 decades of study and experience in mind-related therapies, including neuro-linguistic programs and hypnotherapy. Ma'am is a USC certified law of attraction coach and a neuro-linguistic program master practitioner, advanced Erickson's hypnotist, and under training to be an integrated clinical hypnotherapist. Ma'am has also conducted motivational seminars for thousands of students in schools and colleges and given talks in corporate and professionals. She is also a district chairperson of Lions Club International with portfolio of positive mental health. Ma'am has also been a member of Lion Club International for the past 15 years and served society under various portfolios. She has received multiple Best Treasurer Award and Par Excellence Award by the Lions Club internationally and many awards, including Mother Teresa Gold Award, Medal Award for Social Services. So we welcome all our panelists. Oh, so we would like to start the session. Over to the moderator.
Yes, thank you, ma'am. Yes, good afternoon to all once again. So I'm happy to have our panelists here. So we'll begin the session by understanding who are the stakeholders and the importance of their collaboration. So I'd like to start with our Dean, sir. So, sir, in our university, we have students, parents, and the management. A good relationship among these stakeholders is ideal for the well-being of the student. Since we live in a normal but not so perfect world, and our students face problems which can be academic and or personal, can you tell us about the collaborators and the process of collaboration?
Thank you.
Thank you, Priya. As you know, today everything is collaborative work. Every lot of things has been emphasized on the collaborative work. Yes, in the past, as you know, one person can do everything. That concept was there. I'll just take one example of building a house. If you think previous years, one contractor was given and he used to do everything. But now the concept has changed because we think that student, as you rightly pointed it out, like in the student, when we are talking about salutogenesis, we are talking beyond health. When they have some health problem, they go to the doctor. But we are talking the things which can create the health problem. So this health problem, as you know, maybe psychological, academical, and all these things. So not one factor is identified as a cause of the health. So as you know, collaborator, what according to me is all who are responsible for the students' well-being, starting from the parents in the immediate vicinity of the student. And as he comes to the university, yes, immediately their teachers and as an administrator, yes, we at the higher management level, they must create the environment so that this program can go on. And at the same time, as you know, the faculty, those are responsible for immediately they're coming in contact with that one. And besides that, as you know, people, those who are proficient in counseling, right? So I feel that everybody, starting from the parents, teachers, management, faculty, as a dean or the administrative post and the student counselor, I feel everybody plays their own role as a collaborator. That is what will be my view.
Yes, thank you very much, sir. I'd like to move on to Dr. Shobana, ma'am. So in addition to what Dean sir has said, since we have our Institute of Salutogenesis and Complementary Medicine here in SPV, can ISAM2 be added to the contributors and stakeholders to promote salutogenesis among students?
Thank you, Dr. Priya. The uniqueness of SPV is always its innovation and inclusiveness. This ISCM was earlier started 1.5 decades ago as the Center of Yoga and Music Therapy, focusing on education, research, and patient care. But the important milestone was last year when we were upgraded and amalgamated into the Institute of Salutogenesis. So the focus is now on the entire overall wellness. So it is well-being, focusing on the faculty, students, and the patient. So obviously we look at the wellness and let us see how and in what ways we collaborate to establish the wellness. And here now today it is on the focus of the wellness of our students.
Yes, thank you, ma'am. So it's good to know that in our university, though we are concentrating on the students, we have something for the faculty, the students, and the employees, which together put together, helps the students' well-being, because everybody's mental health is necessary in the end of the day for the students to go out successfully from our university. So now I'd like to move on to Dr. Batmavati, ma'am. Ma'am, we'd like to know about the need for the collaboration in our university. So could you please build on what sir has already said and mention the difficulties of communication that we face between the stakeholders and how it can be overcome to enhance the quality of life of the students?
Okay. Thank you, Priya. The thing is, all of you as a faculty, those who are present in this forum will accept that a single approach will not help the success for the students. So if a student succeeds, multifaceted approach should be done. And especially some students need extra care when they are emotionally disturbed, when they are not able to cope up with the curriculum, the vast curriculum as it is in medical profession. So there are multifactorial factors which can affect their achievements. So a single approach will definitely never help. So as sir told, there are from the beginning, the students, whoever is considered as the welfare people for the students, like the faculty, like the mentors, the parents, the wardens, the student counselors, all people should be cooperative. At the same time, they should collaborate and produce an effective student for leading them a successful life. This is what the difficulty we usually face is there might be a lot of miscommunication between the teams. And usually when we say the mentor-mentee committee, it's a separate entity, and the salutogenesis committee goes on a separate entity. But when we take it as a overall, it is difficult to monitor the entire thing under a single umbrella. So we are planning to make it something which can link each and every committee together, whichever provides support to the students, so that we can get an overall opinion of each and every student in all aspects, so that we can decide there how to go about and how to manage them in future.
Thank you very much, ma'am. I'd like to now go on to Dr. Sivaprakash sir. So our Dean, our Vice Principal and Sivaprakash sir are like the three pillars of our salutogenesis committee. So sir, can you two briefly comment on this?
Thanks a lot, madam. I do concur with what our Dean and VP madam have mentioned. Collaboration is very much important and can be very challenging because there are lots of people who are involved in taking care of the student. Lots of people, lots of committees. So I'll just illustrate with a simple example. Let's say there's a student who's feeling sick or stressed or depressed for some reason, and the student has an exam. Okay, and the student wants to go home, is not able to sit for the exam. The parents probably are not in favor of the student coming home. The parents say, no, you just stay on there and somehow get through the exam. And probably the dean or the VP are also not in favor of the student skipping the exam. The psychiatrist who sees the student says, yes, the student does need a vacation for a week or two. So as you can see, there are different opinions. And it can be very stressful for the student. The student is already going through a lot of stress. So the student can have additional stress if all of us, first, if we have a disagreement, and plus we are all not on the same page. Okay, so that can be additionally stressful for the student. So for the sake of the student, it's important that we are all on the same page. So I should know what the VP has decided. Dean should know what the parents have decided. So collaboration is very, very important.
Yes, thank you, sir. Yes, it is very important because from the student point of view, meeting so many people and then getting different decisions from everybody can be stressful. And already, needing time off and being forced into something which they're not ready for can also be stressful. And like you said, with collaboration, and if everybody knows what everybody is saying, then maybe one decision can be put across to the students, which will help them to, accept it and then go through with it. So it will be very helpful for that. So now I'd like to move on to the next part of our panel discussion. So here we will be viewing the roles of the individual stakeholders in this student salutogenesis. So here we'd like to see who play an important role in the well-being of students. And I'd like the panelists to, elaborate on this topic. So again, we will start our session with our Dean, sir. So, sir, with the students, there are a lot of people who are involved, like the admins, the teachers, the student counselors, the parents, and different departments like the psychiatric department, the yoga therapy department, and music therapy department. But can you just highlight on the roles of the admin and the HODs, what they play in the with the salutogenesis of the students?
Yes, Priya. Like, as you know, like stakeholders are many. So when and everybody's role is very important. We cannot ignore one person for that particular reason, any reason. So only thing is that problem is that what we face as the administration, where to start and how to start. So first thing, I think all of you must have, those who have already attended this session, this salutogenesis session. For us as the administrator, the identification as of now, although we say that there are a lot of identification, screening, and all these things happens. But how we identify is basically their academic performance, their attendance, and all these things. So that is the first triggering point. What we take it, okay, these students need help. And this information definitely we get from the department on the regular basis. And once we identify the initial phase, as you know, like as administrator, we have our list of the students who are not performing properly and all these things. And for that, this information, our what you can say, we get the information from the department provides this information, and we have preliminary meeting in our administration office, which involves vice principal curriculum, vice principal student affair. And based on that, as you know, like we think that, okay, these students need additional support. And in that way, as you know, some students are really high achievers, right? So two types of students we get: one who need additional psychological support and who needs advanced support. So those, based on that only, as you know, like we next we involve that, okay, these students needs support, then we refer them to the counselor, right? So, and basically, as you know, even if sometimes, as you know, initial interaction is very important, because all of a sudden we are new face to them. They may not open it with us, because, as you know, we are always busy with some other things. So development of the confidence by talking to them, by spending time with them, usually it starts with our counselor, right? From there, so first we pick it up, and finally we initiate the process, and subsequent the process goes on. So that is what I think as an administrator, our role is to identify, although we have some mechanism to identify the students or to follow up them students. I think in the due course of discussion, it will come up how we identify and what we do. Thank you.
Thank you, sir. Next, I'd like to go on to Dr. Vatma ma'am. So she heads the mentor-mentee program. So ma'am, in this, the teachers, mentors, and wardens play the important role. So can you explain their role in the salutogenesis?
As a mentor. You're
As a
asking
teacher, as
as
a
a-
mentor, and a warden, roles of
Okay.
3 of them.
Okay. Coming to the role of a teacher, all of you know, as a teacher so far, when we were doing our undergraduation, all the teachers were more focused on our academic performance. So a teacher's major role is towards the academics, how they are doing, and they are in close monitoring how each and every individual is doing. So a teacher's role will be more towards the academic performance. This nowadays NMC insists that all the medical colleges should also be having a mentor who's a existing faculty member. So far, there is no special training, but still, as years of experience we can gain, and we can definitely mentor any number of students, and based on their approach, we can guide them. So when it plays, there is a marginal difference between a teacher and a mentor. And mentor mainly focuses on setting some short-term goal or a long-term goal for the benefit of the student. And they will give them feedback to improve themselves. They give emotional support, which will not be commonly happening with the faculty as a teacher. But depending upon the situation, a teacher can change over to a mentor. Coming to the warden is not a part of the curriculum committee member. And there is no hard and fast rule that they will have examinations. So the approach towards the teacher and the mentor will be different. But if a warden is more approachable, the student will be comfortable in approaching them. They can share their emotional disturbances or whatever the difficulty they have. They can be friendly and talk to them. They can open up if they have any difficulties. So that can help them, because in the absence of their parents, and if they find it even difficult with their own peer group, and they cannot open directly to a teacher or a faculty or a mentor sometimes. So if a warden is more approachable. For definitely for a residential student, they will be more helpful and this regard. Yes, sir.
Yes, I do agree. Like, not only the warden will help. As you know, sometimes, as you know, we enter some work or the observation of the students, because as you know, many times, as you know, like the students spend after work, class hours and all these things, they spend a lot of time in the hostel also. So suppose some student has been identified as a need support. So even if they don't interact with the wardens and all these things, as the administrator, we can use the wardens to monitor and to observe and a given report, so that what you can say further process can be improved. Thank you.
Thank you.
Yes, sir. Thank you, sir, and thank you, ma'am. Yes, ma'am, I completely agree with this, that teachers, they play the role of the academic role and the mentors. And I find that the present generation teachers are more approachable than they were like 15, 20 years ago. So students practically see us as friends. Now they wave at us and smile. So I think that is a good rapport that we have created with the students. So even if they're not able to approach us among a crowd, they do tend to seek us out in private and talk to us. So I feel that the mentor program is doing very well, ma'am. Now I'd like to move on to the student welfare department. Here we have Mrs. Josephine with us. So can you please shed some light on the role of the student counselor and the psychologists in the well-being of the students?
Yeah, thank you, Priya ma'am. So most of the time, the student welfare department is the first line of contact, and that is works as an orientation. And at first, the counselor and the students are strangers to each other, as always. And building a good rapport is very, very important. And this has been well done due to the foundation courses, in which in our university, in this year alone, we had a 1 month long foundation course, in which the student welfare department had access to all the students, like more than 3 or 4 times each group. So that built a very good rapport. And this started off with us practicing positive psychology, in which we help them to get more self-esteem levels and more confidence in themselves, and motivate them towards doing better throughout the course. That was a very good opening we have. And then we go into personal counseling. When we go into personal counseling, then we develop more intimate relationship with each student, like assurance and confidentiality, and building of trustworthiness, which is very, very important. And then we go pass on to the clarifying and assessing the present problems, and identifying and setting the counseling goals. Then planning treatment and follow-up will ensure after that. And if necessary, we will talk to the psychiatric department, who are very, very, in liaison with us, and they take every effort to help us in any way. So that's one good thing we are performing here in SPB.
Yes, thank you, ma'am. And I would like to address next question to Dr. Sivaprakash, sir. So as the students do come in, we have the mental health screening, and like we discussed in the previous presentation, students are actually sent to are asked to come to the psychiatry department or to the student counselor. So in both cases, there may be a need to actually call in the parents or guardians. So could you enlighten us on the role that the parent or guardian would play here, and especially when there's a line of treatment that needs to be done for the student, and how you get them involved in this process?
Thanks, Priya. Engaging parents, it can be quite challenging. We have experience over the last 20 years almost. We have seen a variety of parents, UG and PG students' parents. We find that some parents are optimally engaged. They have a healthy approach to their ward. Sometimes, unfortunately, we do come across some parents who are disengaged, or sometimes even when there is a negative approach towards the child's situation. So that can be very challenging. And there are situations wherein we have had some parents even blaming the institution and saying that my child was absolutely fine, it's the institution that's to blame. There are some parents who unfortunately have denial also. No, my child doesn't have a problem. So all this is unnecessary. And we have also some parents who sometimes become defensive. Just a few days ago, we were interacting with the parents of a PG student, and we were pointing out the problems being faced by the PG student. And the father actually came up to us and said, we have raised our son very well. So obviously, maybe they thought we were implying that they didn't do a good job of parenting, which is why the son is having such a problem. So they can become a bit defensive. So we will have to have a very sensitive approach and make sure that we don't talk in a way that we are assigning blame on them. We encourage them and approach them, as appropriate. But one important take-home message is we have to involve them very early. We do not wait for a crisis to happen. The day, as was pointed out earlier in the program, the day they join, we have a program for them, maybe a separate program for the parents. We orient the parents, and we create a WhatsApp group with the parents alone, and we give feedback to them, and we go beyond marks and attendance. We just don't tell them about the marks attendance, but we just go a little beyond and give them periodic information about how their daughter or son is performing. So I feel we'll have to start early and have periodic sessions, maybe once in 3 months or so, and continue to engage with the parents and not just wait for a crisis to happen. That is my view.
Yes, thank you, sir. And also, I find that like if a person has a disorder of any sort, they are more open to discussing it with people. But when it comes to the mental health, they have they inhibitions about discussing it. So I feel, yes, when you engage the parents and or guardians here at an early stage, even though they may be defensive in the beginning, I'm sure that with proper counseling and talking to them, they will be able to understand, and in the long run, it will help the students,
Absolutely.
benefit the students. And as I have you the mic here, sir, I also like to know from your experience, what is the role of the psychiatrist in the well-being of the student?
Actually, we are, at one end of the chain, as was pointed out in the algorithm also. Only some students get referred to the Department of Psychiatry. Those who really need medication, who might qualify for a psychiatric diagnosis, and who can't be managed with just counseling and therapy alone. But when a student does come to us, we try to follow the same method as for any other client who comes to our department. We have a structured initial assessment process. And we start off by destigmatizing. We try to tell the student that it's a good thing they've come to us. And whatever feelings of stigma might be there in their mind, we try to minimize. We can't maybe completely remove it, but we try to minimize it. And we try to reduce the anxieties that might be there in their mind with regard to seeking help. So, and once we do the initial assessment, one important goal is to assign a risk category. Is this student at a low risk or a moderate risk or a high risk? What risk are we talking about? We are talking about risk of harm to self, because we do come across students who have suicidal thoughts, who sometimes even attempt. And there are some students, unfortunately, who become a risk to others also. Sometimes they can become agitated, sometimes even a bit aggressive. So risk stratification is very important. And accordingly, the Department of Psychiatry has to decide which are the people I need to inform. Definitely, we have to give feedback to the admin, to Dean and VP Madam in a confidential manner. And we take the permission of the student. We tell the student, see, the situation is such that we do need to inform admin. I hope you're okay with that. And there are many students who say, don't inform my parents. I don't want anyone to know about this. So that's extra challenging for us. So we need to somehow spend a lot of time, convince them why we need to involve someone from the family, why we need to involve someone from the admin, and assure them of confidentiality. And sometimes we try to involve a trusted friend also. We ask them, can you identify a friend whom you trust? Can you bring that friend along also? And we try to basically enhance the support system. And of course, if we need to prescribe, we do with the consent of the student and the parents. And we engage with the student counselors and admin so that follow-up happens. The student might have to come back to us. Last but not the least, if the student and or the parents say, yes, they feel treatment is needed, but they want to do it elsewhere, then we facilitate referral. Maybe they want to go to another hospital, maybe in their hometown. So we are okay with it, but we will facilitate and continue to stay in touch. So that's the role of our department in a nutshell.
Thank you very much, sir. And sir, I think it's really good that, you build on the support system for the student, because when they come in, they feel that they are alone in this. And when you sit down and you talk to them and you make them understand that it's okay to feel how they feel, and that it's important that the administration is also involved and a friend and the parents are also involved is important. So when they accept this, I feel that the support system is built, which helps them bounce back even faster.
Absolutely, you're right.
Thank you, sir. And yes, in our university, we are very unique in the fact that we have our music therapy department and our yoga therapy department. And this caters to the mental well-being of our students. So even if it doesn't, the students don't go directly to them with a problem, just, undergoing music therapy and yoga therapy sessions, it helps them to increase their self-esteem and self-awareness. And as a session, I guess they are more aware of what are the different kinds of methods that they could use to maybe relax and gain more mental well-being. So Shobana ma'am, can you please tell us from your side of music therapy, how does it impact the students when they come to you?
Yeah, thank you. So the presence of an institute for salutogenesis itself shows that how much the institution focuses on the well-being of all the stakeholders. Now, we have two schools, the School of Music Therapy, which I would be telling, followed by my colleague, Dr. Balaji, who will talk about the yoga therapy. So the School of Music Therapy, we have sessions for all the constituent institutions. So all students have music therapy activities right when they enter into the college in their induction itself. All colleges have. So they undergo the music therapy or they experience the music therapy activity in small groups. So this gives two important benefits. One is they experience the benefit of the activity. And number two, they also are aware of what is happening or what is possible in the music therapy unit. It is not only making them relax always. As you know, these students are right coming from their school into a professional college. So it is obvious that they have a lot of inhibition. So participating in such activities will help them overcome their inhibition to be more expressive. So it obviously it improves their communication with their peers, with their teachers, so in future with the patients. So what happens is we just open a door or we show them a path that this is available for you. And if you are interested, you can come and you can take part in that in future. And I would like to clear two misconceptions here to all the delegates here. One is to undergo or to participate in a music therapy activity. It is not just hearing music. It is actively participating in various activities. So one of such activity, which is a pride one for the School of Music Therapy, which has been developed for student welfare, is called as MEETS. It is copyrighted. It goes as musically express your emotions and thoughts for success. And since 2015, we have these sessions for all our students in all branches. So it is just an opening of that. And number two, you need not be musically trained to do that. It is enough if you have a passion or if you just have a belief or if you just experience once, you will know how much it helps you. For example, as I started, it will overcome your inhibition. It will improve your expression. It will make you feel you are a part of a herd. belonging with so many students. I'm not alone. I have so many along with you. So there are innumerable benefits of that. So we open up to all the students who come there, and we are most welcoming them to take up in future. If they want the other activities from the music therapy unit, it would be in their education, in research, and for their own wellness. So in this, I would like to mention the salutogenesis term, which was coined by Aaron Antonovsky. His son, Avishai Antonovsky, has identified our institute, and we are very proud that he had unveiled the picture in our center, and he has included our center in the global platform stars of the salutogenesis. So I would be very happy to share all this with you.
Yes,
With the platform.
that is an honor to a university indeed, ma'am.
Yes.
Yes. Sir. And going on to Balaji, sir. So can you tell us about the impact that the yoga department creates when the students come for the sessions?
Good afternoon, all. Thank you, Priya, ma'am. So yoga is Anubhava Shastra, where you have to perform and you have to experience the benefit. It is not like a theory. And it's not a yoga therapy, it's yoga. Yoga therapy is a drop in the ocean. See, in our WHO definition, we have 4 quadrants of health. The yoga, what we follow is Ashtanga yoga. That includes all the 4 quadrants, like the physical, mental, social, and spiritual well-being. And the most important concept of yoga is do no harm. That is the most important first rule of medicine also, do no harm. As Siva Prakash sir was speaking about, they have a tendency to harm themselves or tendency to harm others, or as you're speaking in your presentation, that they come with more anxiety and stress. When they exposed to yoga, we have a lot of scientific proof that yoga is one of the best antidote for stress and psychosomatic disorders. And when they come into the yoga, they experience that how to attune positively to emotions, how to express the emotions positively. That is the most important aspects we are seeing in the School of Yoga Therapy of ISCM. And based on this, yoga has become a part of curriculum. To the best of my knowledge, I have never heard any medical college is having a yoga in the curricular basis in all disciplines of SBV. So, and on the basis of it, Yoga Abhyasa program was started for all the students who have to definitely undergo the yoga training throughout the educations when they are starting to finishing the studies. So as Madam said, we are also planning to conduct the salutogenesis credit course, which is going to be done by the Avishai Antonovsky, the son of Aaron Antonovsky. He is going to start that salutogenics course for our School of Yoga Therapy in ISCM, and it's going to open for all the SBV faculty. That is one of the uniqueness of our ISCM, which is there in SBV. So yoga not only works in physical level, it also works on all the 4 quadrants of the WHO, and it helps to promote not only the physical health and the mental health and well-being of the students.
Yes, thank you, sir. I have personally seen the students when they go for the music therapy or yoga therapy, they are always very happy. And usually we divide them into groups every day. So when I say group E go to music or yoga, they happily go immediately. They know where to go. I say, do you know where to go? They say, yes, I block, I know. So they don't need a person to actually accompany them. So I feel that is a good impact that it is having on the students. And also us having these 2 departments, along with the psychiatry department, the student welfare department, and the admin, having these 2 departments helps us give the students a more holistic development. And it helps them be aware that since they are in the medical profession, along with medical treatment, there are other alternative medicines which can help a patient, so that when they, as doctors, they will be able to guide their patients better and be better counselors for them. So I feel that these 2 departments are very useful for that. So we will now go into our next part. So till now, we have actually discussed what we've been doing in our university, the challenges and strategies that challenges we have faced and the strategies we have used, and who are the people who are involved, the stakeholders. Now going forward, we'd like to go into what are the challenges are faced and what solutions could be implemented going forward, because there is so much more to than what we are just doing. And I think panelists here will be able to, with brainstorming, give us a lot of new ideas as how we can manage new situations, because with the times changing, it is not as it was before. So we can't have like a set rule that like if this happens, we're going to follow A or plan B or plan C. So as the situation changes, we need to improvise, and I feel our panelists will be able to, enlighten us in that manner. So I'd like to start with our Dean, sir. So, sir, can you explain to us how we can break the silos and enhance the collaboration among the stakeholders, and thereby enhance the quality of life for the students?
Yes, like as you know, like it's a challenging job as an administrator. Many times, as you know, even four member family, they fight with each other. So similarly, as you know, when we are collaborating, with the different stakeholders, so they are different. Yes, all are adults and all are with their own ideas. And sometimes, as you know, like individually, every stakeholders are good, but when we come together, accepting the other's idea, sometimes it is not possible. So as you know, during that time, as an administrator, yes, we have to take one policy decision which may not be acceptable by all, but finally we have to see that who is we are working for the student and what works better for the student, and that we need to follow up, even if some things as an administrator I should not try to impose my ideas on the others. So definitely, as you know, it's a challenging job, and everybody should accept that yes, my ideas may not be accepted if other idea is better than that. So that openness among the stakeholders is most important, and mindset that yes, what we are doing is our focus is on the student. It is not the my idea. If other ideas are better, the works for the students, definitely I have to accept, even if as an administrator I should not have any ego. So that, as you know, as you grow old and all these things, that type of egos comes up. Why my ideas was not taken and all these things. But finally, as you know, yes, it is not the questions of my ego. It's finally the beneficiary who is the student and what works better. So that's a challenging job. And as you know, as a teamwork, definitely one or misunderstanding is to happen, but that misunderstanding should not persist for a long, because as you know, it's not that we are working for a particular duration. It is for the lifelong. The students is with us. So 5 years, 5 years, we have to show the solidarity among ourselves so that student will not feel that whomever we approach, the approach will be same. So that is what I feel like. Because yes, silos can be broken down by our change of mindset and accepting a policy, and that policy should be followed up by everybody. Thank you.
Yes, sir. Thank you, sir. Yes, I too also feel that it's important that everybody is on the same page, like Dr. Prakash had said earlier, so that the student is comfortable in approaching any of us. I'd like to go on to Dr. Batma, ma'am. So, ma'am, here students' general well-being, the mental health well-being of general students in general, and also the snaps that we identify in the beginning. Ma'am, what are the collaborative methods that play an important role in the communication between the stakeholders here? And could you mention a few methods that you have found to be effective in your experience, and other methods you feel that could be applied here?
Okay. Regarding the choice of communication, it all depends upon the stakeholder who we are approaching, and also the severity of the situation and the nature of the situation. So all matters. And usually particularly when we focus on students who need additional psychological support, it should be more confidential. and we cannot post it in any WhatsApp group where the common, all the students are there, and we have of parents group also where we cannot post in those groups. So it should be confidential. So the better economical way will be email communication can be sent, and always email. The only drawback with the email communication is out of 250 students, their parents all won't have access to an email. We have seen parents who don't have an access to an email, and most of the time the parents' email is filled by the student themselves, and they have mentioned their own email ID in the place of parents' email ID. So there comes the difficulty to communicate to them. So no other go at that time. We call them in person over phone, and we arrange for physical meetings. And another problem is with the parents is many may be staying abroad. So at that time, we have to arrange a online meeting for them to sensitize them about their ward status and their psychological well-being. And we have other WhatsApp group. Even we have a student database, Garuda, which is inbuilt in our university. And for the past 2 years, we are giving the access to the parents also, so they can log in and check the academic schedule and how they are doing and their performance and their attendance, everything they can monitor. So based on that, they can call us and find out if they have any issues also. And recently, and when the salutogenesis committee formed, we found it difficult to follow up the students. So I think Dr. Shivaprakash sir can highlight about the Trello app, what we are now trying to implement and making it as an effective tool to monitor the progress of the students.
Yes, thank you, ma'am. So you've actually given us, the many means through which we communicate with the students. So I'd like our dean sir to, give us a little bit more in detail about the physical meetings and the virtual meetings that we use, the importance, and when they are used.
Given option, definitely everybody prefers 3D than 2D. Right. So definitely the effectiveness of the physical meeting is there. Like everybody has experienced past during the pandemic, the effectiveness of the online class and the offline class. Initially it was okay, but of late everybody felt that we are not able to connect. That is the main drawback. But given that situation, as Dr. Padmavati mentioned, that many times, as you know, like physical presence of the parents or physical communication with the talking to the EA is not possible due to various reasons. Sometimes they don't want to come to the dean office or somewhere because they don't want to be identified that I need sick, I need help and all these things. So definitely, as you know, during that time, okay, whether it's a phone call or it's a Zoom meeting, and parents, as you know, like sometimes we need parents to be there and we wanted to convey them message and all these things. Sometimes parents are not in a position to come back. Yes, we have arranged online meeting for them also, but we insist, even if online meeting is for the emergency purpose, we insist them whenever they get chance, they should come physically meet us and discuss it out and all these things. So both are important depending upon the situation, I feel.
So thank you, sir. And yes, it's good to have physical meetings, and in places where physical meetings are not possible and you still need to contact the parents, then I think Zoom has now played a very important role, especially with COVID. It has connected us around the world. So parents who do not are not able to come in person for some reason are able to connect with us over the virtual means. I'd like now to go to Dr. Shobhana ma'am. So Batma ma'am has told us about the role of email. So could you build on that a little bit more, ma'am?
Yeah, as Dr. Padmavati had told, it gives a lot of confidentiality, and but for few parents, now people are aware of the digital media, so it could be a good choice of communication.
Okay, thank you, ma'am. And Balaji sir, could you like build on what role the text messages could play among the students and parents?
It gives the role to ability to express, because if you see a person, if you see the face, the off of the question, what you want to ask, you forgot because they are seniors, because they will make you the wrong feeling that they may mistook what you are asking. So that freedom will be more applied in text messages, and the students can, while reading the messages also, the ability of reaction change to a response. That is the advantage of text messages when compared to the virtual other things actually.
Yes, I do actually, I think that's right, because they are given the time and space to think and express themselves more. And also some things which they may hesitate to ask you in person, or they may have like 5 questions on the mind. When they come to you, they will forget and maybe ask only 2. So, and when you give them maybe a response, they have time to think about it and then ask something else. So yes, I think text messages can be very helpful here. I'd like to actually go on to Dr. Sivaprakash sir. Sir, another means of communication is WhatsApp. So nowadays, WhatsApp is everywhere, and most of the students are really comfortable with that. Not only students, parents, and all of us use WhatsApp extensively. So even though it's not a professional platform, what role do you think it could play among the students' communication with us, the students and the parents?
Thanks, Priya. Actually, if used properly, WhatsApp can play an important role because it's ubiquitous, it's everywhere, and almost everyone is comfortable using WhatsApp. So we have personal experience in our department where we have created a WhatsApp support group for a student who needs additional psychological support. So with their consent, of course. So we create a group with the student, one or both parents, and maybe someone from the team. Could be a psychologist or a psychiatrist. So it helps us all stay in the loop. For example, the student is sick, has gone home. We've asked the parents to do something, get some lab tests done, get some counseling done there locally. So they update us on the group. Yes, this has been done. Now he's doing well. He's eating well. She's sleeping all right. We are following the methods, you know. So we encourage the student also to post in the group. So it's just a method of staying connected. And the advantages later, we also have a record of what's happened, you know, though it's informal. I do agree it's informal, but if used in the right way, yes, WhatsApp help groups can play a very important role.
Yes, sir. Thank you, sir. Because as ma'am mentioned, the emails, that some parents don't have emails, they don't see emails, and
Yes.
even text messages, you can message only one person at a time. So in WhatsApp, since we are able to have groups, we are able to have everybody who's necessary all in one place.
Absolutely.
So that makes communication more easier, and it helps to avoid any miscommunication, so that the student is not affected, sir. And since I have you here also, since you're like an expert in the electronic tools, so could you like elaborate on the use of specific electronic use for the collaboration of student salutogenesis, how it could help the students, help the students better?
Yeah, as has been found in several other professions and industries also, very often electronic methods are the solutions, the best solutions to breaking down silos and enhancing collaboration. Many other industries have adopted it very well, but maybe we are lagging behind a little. So to extend it from the WhatsApp situation I explained just now, see, WhatsApp can be a little informal, and you can engage the student and the parents, and maybe with 1 or 2 members from the team. But we need a more robust system, an electronic platform, wherein all of us can collaborate, including maybe even the warden, the psychologist, psychiatrist, the entire team of people who are helping the student who needs additional psychological support. So we've been testing out an app called Trello, which is used, of course, for several purposes. But we found that it can be used in an appropriate way for this purpose too. It is password protected, so access can be limited. Only those who have a password can access it. So we create a card, it's called a card, an electronic card for any student who needs additional psychological support. Then we add people to the board, to the Trello board. in line or two. And the most important thing is we can post updates. Let's say the student met VP and has asked for 1 week leave. Madam can post in the group. And maybe the student is supposed to see you the next day. Okay, and madam posts, okay, I've given leave. So you won't be expecting the student tomorrow. And let's say the student has an appointment with you the next day, but the student hasn't turned up. You can post an update in the Trello card. This student X was supposed to have a session with me, but hasn't turned up. So we are all alerted. So, and I think it can solve a lot of the communication issues and the silos that we have been facing over the years if we use an electronic platform efficiently. And the biggest advantage is it will be there on our mobile phones. You don't need a computer. So that I feel is, and it doesn't have to be just Trello. It can be any method. It can even be a software developed by the university. But since it is easy, it is free, we've been trying it out.
Yes, sir. Thank you. And nothing, actually, I feel that this is also, it helps with time management, because if ma'am has decided something and is posting on the group, so all of us know immediately, so she doesn't have to contact each one of us individually. So I feel it helps in that. And actually going on to ma'am, ma'am, we use different tools for different stakeholders. So what tools do you think is appropriate for specific groups of stakeholders?
Obviously, for parents, it will be better to use WhatsApp. Even students, it's better to go for WhatsApp. Email communications will be more appropriate for faculty members and mentors. And even in general, as sir told, WhatsApp is the best communication tool now available for any group of people.
Okay, ma'am. Yes, actually, I'd like to move on to Student Welfare Department, Mrs. Josephine. We deal with the students day in and day out. And as departments, we collaborate with each other. So they are actually exposed to a lot of faculty members here. So what do you feel is the best way to deal with the privacy of the students, as that is a very sensitive issue? And how can be protected better, keeping in mind not to intrude too much into the students' personal space in our eagerness to help them?
Yeah, thank you, Priya. See, to start with, reassurance and trustworthiness is a must that we create by talking to them and creating a very good rapport. And in our university, we have separate counseling rooms, which is inside the college itself. So they don't have to go out into the any other block for that. So they are in a space where they, just walk around every day. So they don't feel out of place. For one thing. And then we talk to them and we make them comfortable in our presence. That might take even 1 or 2 sittings, because talking to them and getting the actual problem out of them takes some time. So because they cannot open up immediately. So that we have to be first patient and listen. So the listening ability we need a lot, and the questioning ability, so that we target the correct problem which is affecting them at present. So, and then what we need to do is motivate them for better compliance, because they just can come once and they don't come again, then it becomes a problem. So they have to feel that they can trust us, and then they can be sure that we are doing everything for their betterment. So when they trust us enough, they will come again. And from the initial disclosure to the in-depth exploration, and then we have our Department of Psychiatry on hand whenever we need it. And we get a commitment to action from the student. So when they have that commitment, when they give the commitment, they feel that they should follow up with that. So that is very important. Then we go with the evaluation from time to time, and it follows up with termination or follow-ups. So then the student is also happy, and we are also that satisfied that we have given a very good session and counseling advice to them.
Thank you. So actually in the beginning, we had discussed about SOP. So I'd just like ma'am to briefly tell us, like, we have a committee, salutogenesis committee. So every committee needs a proper structure. So could you like tell us how a formal SOP would support the collaboration of the departments in this?
SOP is a must for each and every action. Actually, we can demark and we can allot the responsibility. There won't be any overlap between the people. So there won't be any miscommunication regarding the task. So each one will be oriented to what to do and how to do, and it will be more effective. And one thing to be noted is, based on the feedback from the stakeholders, we have to change and refine the SOP frequently, so that it will take in the right direction and we can do still more better whatever we do.
Thank you, ma'am. I completely agree. And it is important for it to be both flexible and adaptable. Because once we have a structure, and as we come across different situations, it is important to improvise so that it, in the end, it benefits the student. So I'd like to thank all our panelists here. So we come to the end of this session, and I'm sure that we are all happy with the outcome of today's panel discussion. So here today we've covered methods we've experienced in our university, the challenges we've faced, and the strategies that we've used. It's also very interesting that we were able to discuss possible strategies to enhance the quality of life of students, which has brought new light into that area. I encourage the audience to also try out some of the methods discussed here in their respective institutions, and if possible to give us feedback. I'd like to take this opportunity to thank the panelists for their valuable time, their valuable shares. I thank the audience for their presence and participation. I thank the management for their support in conducting this program. I would also like to thank the technicians, attenders, and Dean's Office staff for their support. I thank the team of Student Salutogenesis Committee for the good job that we've done till now. A small information is that our next FDP will be held tomorrow as scheduled on the 16th of Feb 2023 at 2 p.m. I'd like to thank you once again for all of you for joining here. And I hope this was informative and it was useful to all of you. Sir, can we take some questions? So, if there are any questions in the chat box, we will take them up. Okay, if you have any questions, maybe you can post them on the WhatsApp group and the concerned faculty will respond to you. So thank you all once again for attending this session, and have a good evening. Thank you. Thank you, sir. Thank you, ma'am. Thank you.